So Cuomo, throughout the early months of the coronavirus, said that the elderly homes and the nursing facilities didn't have a right to turn people away, even if they had coronavirus symptoms or had coronavirus. Why do you think that was the case?
Well, I want to believe that he did it for legitimate reasons, that he was worried that his hospital systems were being overwhelmed and that there wouldn't be room in the hospitals when you had extra beds in nursing homes. But as it turns out, that wasn't the case. There was not a single person in any New York hospital that did not have access to a ventilator that needed one, despite the governor going on TV over and over and over again demanding that the federal government send him more ventilators. They had an abundance of ventilators. As a matter of fact, President Trump and the federal government even sent a Navy hospital ship to New York. The Army Corps of Engineers opened up a hospital facility with over 2,000 beds. I think maybe they put 100 people in it. The Navy hospital ship had only a handful of people, and soon it needed to leave because there was just no reason for it to sit off the coast and do nothing. So although initially it appeared that the hospital systems were being overwhelmed, and I don't blame Andrew Cuomo for being concerned about it, the reality though, he made a huge mistake by sending COVID patients into nursing homes. I mean, the statistics speak for themselves. And I'd just like Governor Cuomo to apologize, to acknowledge his mistake, and then we can get on with it. But now he's blaming the federal government for demanding that he send those patients to nursing homes. And the reality is that's not the case. Look at Governor DeSantis. Look at governors throughout the country. They didn't do that, but Governor Cuomo did. And it was a huge mistake, and it's cost dearly. You know, when you look at New York, New Jersey, Michigan, where those governors, and I don't want to give them bad motives. They were trying to reduce capacity in the hospitals, gain capacity in the hospitals by moving patients into nursing homes where they had plenty of beds. I get why they did that initially, but as a direct result of that activity, we saw massive deaths in nursing homes and assisted livings. And that wasn't the case in all the states. If you look at, for example, Governor DeSantis from Florida, he decided not to do that. He purposely said, no, I see that this disproportionately affects older people. I'm going to protect the most vulnerable, and in particular, those in nursing homes and assisted living facilities. And as a result, look at the numbers. Don't take my word for it. He's done a wonderful job. His nursing home population and assisted living population has fared far better than other states that took that tact of taking recovering COVID patients and putting them into nursing homes.
So when it comes to the coronavirus, who is most at risk?
It's not even close. Overwhelmingly, it's older people that are at risk, and specifically those that reside in nursing homes and assisted living facilities. You know, if you look at the statistics, close to 50% of all deaths in the United States have been people that reside in nursing homes and assisted living locations, despite the fact that they only represent somewhere around 0.5 or 0.6% of the population.
And how long have the experts and the general public known that the elderly are most at risk?
You know, right out of the get-go, it was obvious that the younger population was being spared, and it was really hitting the older population very hard. So we've known about this since, late March, even early April, possibly even before. This is not unique. This pattern of virus disproportionately affecting the old is pretty common. So we've known about it now for a long time.
And does it get exponentially worse the older you get when it comes to how likely you are to get infected?
Yeah, don't believe me. Look at the CDC statistics. So the older you are, the higher the death rate. Now, part of that is because older people obviously are more likely to have pre-existing conditions, heart disease, lung disease, etc. So they're going to be disproportionately hurt. But the older you are, the higher the mortality rate. And interestingly, if you look at the younger population, less than 40, let's say, the death rate is very, very low, even lower than a seasonal influenza rate. You go down even lower at our children, less than 25 years old. Less than 25 years old, a person has a greater chance of being killed in a car accident than they do from COVID-19. But yet here we are trying to figure out how to open up schools, even though our kids are absolutely not at risk.
I featured you in a bunch of videos so far. You've been to protests, you've been giving speeches at rallies. How's the feedback been? Have you been kind of getting some flack for speaking out?
Yeah, thanks a lot for doing that. You know, listen, I never wanted to be in the spotlight. It wasn't my intention to be some social media national star. I don't enjoy doing that. I don't like doing that. You're filming me here in my office. This is where my passion is, taking care of patients. But to the extent that my voice represents that of other physicians around the country, and I believe it does, because I've spoken to physicians not just around the country, but now around the world. I had a doctor from Kuwait call me. I was on a program from the UK where many physicians feel the same, that if I have that platform and that opportunity, I'm going to use it because I think it's important that citizens hear a different narrative. The mainstream narrative, in my opinion, isn't the correct narrative. I believe what I'm saying is more in line with what we should be telling people. We need to get rid of this fear-mongering. We need to protect the most vulnerable, and that's the oldest Americans. And we need to open up our economy and let people like you and me and our children go back to school, go back to work, and get this economy rolling again. Fear is not serving us well at all.